UAB Medcast is an ongoing medical education podcast. The UAB Division of Continuing Education designates that each episode of this enduring material is worth a maximum of 0.25 AMA PRA Category 1 credit. To collect credit, please visit uabmedicine.org/medcast and complete the episode's post-test.
Welcome to UAB Medcast, a continuing education podcast for medical professionals. Bringing knowledge to your world. Here's Melanie Cole.
Modern autonomic function tests can non-invasively evaluate the severity and distribution of autonomic failure. My guest today is Dr. Mohammed Kazemal. He's an assistant professor in the Division of Neuromuscular Disease in the Department of Neurology at UAB Medicine. Welcome to the show, Dr. Kazemal. Let's start with the grouping of the autonomic disorders that we're discussing here today.
Thanks, Melanie, for having me. In fact, the autonomic disorders that we are able to test for are divided into different categories, which include disorders of maintenance of the blood pressure like orthostatic hypotension and the famous postural orthostatic tachycardia syndrome, which is referred to as POTS. We also try to test for a growing disorders of the peripheral nervous system called small fiber neuropathy. And small fiber neuropathy happens when a patient comes to our office complaining of tingling or burning sensation in their feet, and we perform the regular routine nerve conduction studies on them, and these studies come back normal. So there is no effective way of evaluating small fiber neuropathies other than performing autonomic function testing on them and also performing skin biopsies. The third category of the autonomic dysfunction diseases include the central neurodegenerative disease like multiple system atrophy and the different Parkinson plus syndromes. These disorders manifest with the movement disorders, the tremors, the dementia, and all of this. They also present with dysfunction in their autonomic functions. Oftentimes, patients with multiple system atrophy, they develop significant hypotension and orthostatic intolerance when they stand up, and they cannot be distinguished that much from an advanced Parkinson's disease patient, because in advanced Parkinsonism, you have the same hypotension, and also the treatments that are used in Parkinsonism lower the blood pressure. So we need different autonomic function testing to differentiate a severe neurodegenerative disease as multiple system atrophy from just a Parkinson's disease case.
What other symptoms would present with a patient that would indicate the autonomic testing?
So symptoms that indicate autonomic testing, again, if the patient have painful burning sensation in their feet or they have tingling sensation while we perform the nerve conduction study and find them normal, then they have to be referred for autonomic function testing. Also, symptoms of orthostasis in general, like inability to maintain the blood pressure while after standing. These patients start developing symptoms of cerebral hypoperfusion, like headache, dizziness, giddiness, blackouts, pain between the shoulder blades, and some of them also develop symptoms of adrenergic activation, like feeling of heartbeat racing, chest pain, tremors, increased anxiety, all of these.
And if they present with some of these symptoms you've discussed, what are some of the tests that you're using now, Dr. Kazemal? So
the 5 standardized autonomic function tests that we use here in the lab include first the QSART, or the commercially available option of it, which is called the QSWIT. QSART stands for quantitative pseudomotor pseudomotor testing, and this test measures the sweat response in different parts of the body, including the forearm, the proximal leg, the distal leg, and the foot. So what we do is that we stimulate the skin sweat glands with acetylcholine, with ionophoresed acetylcholine, and we measure the sweat response from these areas. And depending on which areas in the body that do not produce too much sweat, we decide what is the distribution of the small fiber neuropathy. We also do the heart rate response to deep breathing, and this is one of the most sensitive testing for evaluation of the vagus nerve function. What we do is we ask the patient to breathe heavily for 6 or 7 cycles, and then we evaluate their heart rate while they are breathing heavily. And we average the mean difference between the maximal heart rate and the minimal heart rate. And if that mean difference decreases, that's a very early sign of vagal neuropathy. We also do the Valsalva maneuver, and we try to record the heart rate and blood pressure response to patients when they strain during the Valsalva maneuver. What we do principally is have them forcibly exhale through a bugle, generating a 40 millimeter mercury forced expiratory pressure for 15 seconds, which is a very laborious job. And we try to generate a curve of how their blood pressure and their heart rate respond to that. We also do the head-up tilt table testing, and we measure the blood pressure for the patient while they are supine, and then we tilt them over 3 seconds to an upright 70 degrees angle, and we leave them in that position for like 10 minutes, and we record how their blood pressure and heart rate respond to that. A final test is a very unique test, which is the thermoregulatory sweat test. And in that last test, we depend on a certain type of powder called Alzarine S. And the Alzarine S powder has a unique character of changing its color when it gets exposed to sweat. So what we do is we bring the patient, dust them over with all over the body with this powder, and the powder, while it's dry, it's purple in color, while it's dry, it's yellow in color, and when it gets wet with sweat, it changes its color to purple. And then after we dust the patient with this powder, we insert them into what's called the autonomic chamber and try to raise their core temperature only 1 degree from 37 centigrade to 38. And as they start to sweat, the powder changes its color, and that tells us which part of their body does not sweat. And certain patterns on that test leads to different diseases. So these are the 5 different modalities of testing that we perform in the autonomic function testing lab.
Dr. Cozumel, when you're using the tilt table and doing Valsalva, are there certain medications that you'd like your patients to not take that day of the testing that might interfere with sweating before the test?
Well, that's a very, very important question. So certain over-the-counter medications like allergy medications, the antihistaminic medication like the Benadryl, for instance, we try to ask our patients not to take them in the 48 hours before testing, because these medications have anticholinergic properties and they decrease the amount of sweating, so they interfere with our testing. Other medications that we ask the patients to stop to, like the alpha agonists, including the prostate medications and the beta blockers. However, for the beta blockers that are used in treatment of hypertension or cardiac dysrhythmias, we are sometimes able to leave that to the discretion of the prescribing physician, because stopping those medicines even for 24 hours can be a problem for the patient. So these are the 3 or 4 different categories of medications that we would like the patient to stop before performing the test. Also, we would like them not to smoke or drink caffeine within the last 3 hours before testing, and we would like them not to drink alcohol on the night before testing.
And for more information about testing results and making a differential diagnosis, you can visit uabmedicine.org/learnneuro. And then in just the last few minutes, Dr. Cozumel, how can a community physician refer a patient to UAB Medicine?
So We are working currently on our website that has a link that the community physician can fill out a form and send it and fax it over to us and the neuromuscular division disease. Also, they can call our office at UAB Neuromuscular Division Disease for referrals.
And tell us about your team. Why is UAB so great to work with?
Well, UAB has a lot of potential for growth. We here have a very large department of neurology that includes more than 65 physicians and scientists in different categories and subspecialties of neurology. And we all collaborate with each other to provide the excellent standard of care to our patients. On the other side, we also have major collaborations in research, and we believe that the autonomic function testing lab will provide excellent service to our patients and to our community physicians in different aspects. We expect referrals to come from neurologists. We expect referrals to come from cardiologists and family physicians and internists.
Thank you so much for being with us today, Dr. Cozumel. You're listening to UAB Medcast. For more information on resources available at UAB Medicine, you can go to uabmedicine.org/physician. That's uabmedicine.org/physician. This is Melanie Cole. Thanks so much for listening.